This drug, Fruzaqla 5 mg capsule, is used for the treatment of colon and rectal cancer. It belongs to a group of drugs called Protein-Tyrosine Kinase inhibitors. It works by slowing down or stopping the growth of cancer cells in the body. It is important to take this medication as prescribed by your doctor and to follow their instructions carefully. The recommended daily dosage and optimal timing will be determined by your healthcare provider based on your individual condition. When taking Fruzaqla 5 mg capsule, it's important to carefully follow the instructions provided by your doctor. Typically, you will take this medication by mouth, with or without food, once daily for 21 days, followed by 7 days off treatment. It's important to swallow the capsules whole and not to increase your dosage without consulting your doctor. If you happen to vomit after taking a dose, do not take another dose. Instead, wait until the next scheduled time to take your medication. It's also important to take this medication at the same time each day to get the most benefit from it. It's crucial not to handle this medication if you are pregnant or may become pregnant, as it can be absorbed through the skin and lungs and may harm an unborn baby. Always consult with your doctor or pharmacist if you have any questions or concerns about taking this medication. If you experience diarrhea, hoarseness, or tiredness while taking Fruzaqla 5 mg capsule, it's important to let your doctor or pharmacist know. This medication may also raise your blood pressure, so be sure to monitor it regularly and inform your doctor if the results are high. Serious side effects may occur, but your doctor has prescribed this drug because the benefit to you is greater than the risk of side effects. It's important to be aware of potential serious side effects, such as signs of liver problems, symptoms of a heart attack or stroke, and a skin reaction called hand-foot skin reaction. If you notice any of these, it's important to seek medical help right away. Additionally, Fruzaqla may lower your ability to fight infections, so be on the lookout for signs of infection, such as a sore throat that doesn't go away or a fever. And in rare cases, this medication can cause a serious, possibly fatal, bleeding, such as bleeding from the stomach/intestines. If you experience any symptoms of a serious allergic reaction, it's important to seek medical help right away. And remember, this is not a complete list of possible side effects, so be sure to reach out to your doctor or pharmacist if you notice any other effects. Before starting fruquintinib, it's important to talk to your doctor or pharmacist about any allergies you may have, as this medication may contain ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have any bleeding or blood problems, heart problems, infections, high blood pressure, kidney problems, or liver problems. Fruquintinib can increase your risk of getting infections or make current infections worse, so it's best to avoid contact with anyone who has a contagious infection. You should also talk to your doctor before getting any immunizations or vaccinations, and be cautious with sharp objects and activities that may cause injury. If you need to have surgery, make sure to inform your doctor or dentist about all the medications you are taking. It may be necessary to stop taking fruquintinib before and after surgery, as it can slow down the healing process. Additionally, women who are pregnant or may become pregnant should not handle this medication, as it can be harmful to an unborn baby. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor before starting fruquintinib, as it can harm an unborn baby. Reliable forms of birth control should be used during treatment and for 2 weeks after the last dose. Breastfeeding is also not recommended while using this medication, as it is unclear whether the drug passes into breast milk and can pose a risk to the infant. Always consult with your doctor before breastfeeding while using fruquintinib. It's important to be aware of potential drug interactions that could affect how Fruzaqla 5 mg Capsule Antineoplastic, Protein-Tyrosine Kinase inhibitors works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with this drug include other drugs that can cause bleeding/bruising, such as antiplatelet drugs and NSAIDs, as well as blood thinners like warfarin/dabigatran. Taking aspirin with this medication can increase the risk of bleeding, but if your doctor has prescribed low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless instructed otherwise. Other medications can also affect how Fruzaqla 5 mg Capsule Antineoplastic is removed from your body, which may impact its effectiveness. Examples include rifamycins, certain drugs used to treat seizures, and St. John's wort. Always consult your doctor or pharmacist for more details and guidance. If you or someone else has taken too much Fruzaqla 5 mg capsule and are experiencing severe symptoms like loss of consciousness or difficulty breathing, it's important to seek medical help immediately. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can contact a provincial poison control center. It's important to remember not to share this medication with anyone else. Before starting this medication and while taking it, you may need to undergo various lab and medical tests, such as a complete blood count, liver function test, urine protein test, skin exam, and heart function test. It's essential to attend all your medical and lab appointments and consult your doctor for more information. If you forget to take a dose, take it as soon as you remember if it's been less than 12 hours since your last dose. If it's been more than 12 hours, just skip the missed dose and take your next dose at the usual time. Don't take a double dose to make up for the missed one. It's important to store Fruzaqla 5 mg Capsule Antineoplastic, Protein-Tyrosine Kinase inhibitors at room temperature, away from light and moisture. Be sure to keep it out of the bathroom and away from children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for proper disposal when the product is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.